Good morning, ma'am. Ako gali si Johanna Eliza Alarcon, isa ka student nurse from the University of San Agustin.
Good morning, nurse. Ari ko di gali subong para magpa-consult regarding sa breastfeeding kag kangaroo care na nila. Kay wala gid ko sinaabi idea kung paano na sila kag nga kinanglan na sila.
Noted, ma'am. So, mamangkot lang ko, pila ka nakabulan, gabusong ma'am.
Mga 7 months na, nurse.
Okay po, so una mo ini nga pagbusong.
Oo, nurse, mina wala gid ko sina idea sang breastfeeding kag kangaroo care.
Okay, ma'am. So, ari ko di subong para mag-explain sa mo kung ano na sila kag magsabat sa imong concern about sina.
Thank you, nurse. Te, ano inang breastfeeding? Naman hindi na siya pwede nga diretso inang gatas nga ginabakal.
Natagantay ka, ma'am, sang mnemonic, sang breastfeeding or pagpapasuso para mabalaan mo kung ano na siya ka-beneficial sa iyong mga baby. May word kita nga pagpapasuso. I'll break down each letters. Pagpapasuso. P. Pinakamahusay na gata sa buong mundo. A. Allergy at asthma ay maiiwasan. G. Galing sa ina. P. Pagtatae ay maiiwasan. A. Anak, malapit sa ina. B. Pag-aabot sa ina, sigurado. A. Agad na maibibigay ng walang preparasyon. S. Sariwa at laging presko. Q. Unang bakuna ng sanggol galing sa ina. S. Sapat na pagkain ng sanggol sa loob ng 6 na buwan. O. Okay sa budget ng pamilya.
Te, nga importante gina siya ayhan.
Mamay ari ko din nga video nga ipakita sa inyo. Halin ni sa akong mga co-nurse nga mag-explain sa inyo about sa inyong question. Okay lang sa inyo, ma'am?
Okay lang gid, nurse.
So, for the importance of breastfeeding, why is breastfeeding important for your baby? So, for the first 6 months of a baby's existence, breast milk provides all the food and water that a newborn requires. Also, you must make sure to feed your infant the colostrum, or the first milk, which is a yellowish color. Your infant is protected from numerous diseases by the colostrum. The baby is protected from allergies, illnesses, obesity, ailments, and infections by breastfeeding. Breastfed babies are also known to have healthier weights as they grow.
Breastfeeding burns additional calories, speeding up your weight loss after pregnancy. The hormone oxytocin is released during breastfeeding, which aids in the uterus restoration to its pre-pregnancy size and may lessen postpartum uterine bleeding. Breastfeeding allows you to spend regular quiet time with your baby, which builds your bond. You can reduce your risk of osteoporosis, breast and ovarian cancer by breastfeeding.
Ay, okay. Sorry, gid, nurse, kay first time mama ko. Pwede ko ka-ask kung paano na ang tsakto nga pag-breastfeed?
Okay, ma'am.
In this video, we will be tackling about one of the most important questions in motherhood. This will be beneficial, especially for first-time moms. So the question is how to breastfeed. So first is the baby-led attachment. So when you allow your baby to latch onto your breast on their own, this is known as the baby-led attachment. Baby should be placed skin to skin between your breast and supported by your arms. Lean back so the infant can lie on your chest and eat it. So allowing the infant to suck your finger can help soothe an upset child. Allow the infant to approach your nipple. Baby may need, of course, assistance, so your infant may incline to lie against your body. Remember to encourage the infant to transfer their legs and body to one side of you if you had a cesarean section.
How to breastfeed baby-led attachment. Baby will dig their chin into your breast, reach up with their mouth open, and cling into your breast when they are just below your nipples. This might occur extremely quickly. How to breastfeed mother-led attachment. When you place your infant on your breast, this is known as mother-led attachment. Hold your infant by the back of the shoulders only, not the head, and tuck them into your chest so their chest touches your own. The nose of your infant should be parallel to your nipple. To get a baby to expand their mouth widely, gently brush your nipple from their nose to their lips.
And for the next one, the mother-led attachment, you're going to place the infant to your breast and then point your nipple at the baby's mouth roof. Next is keep placing your hands on the infant's shoulder and back. A significant portion of the areola will be in your baby's mouth when they attach. And then the baby's upper lip will have more areola than the lower lip.
How to breastfeed mother-led attachment. Baby is properly attached in both mother-led and baby-led attachments when their chin is placed into your breast and their nose is unobstructed. They have a mouthful of breast, a turned-out bottom lip, and rounded cheeks. Baby will start sucking quickly and then switch to prolonged, rhythmic sucking. There are 3 types of breastfeeding positions to try. First, it is common to use the front hold or cradle posture with mother-led attachment. Second, it is the underarm position or football hold. And lastly, lying down.
Amo na siya gali. Te, ano man kadugay ko dapat i-breastfeed akong bata?
How often should breastfeeding be done? Breastfeed your infant whenever they ask, day or night, at least 8 to 12 times per day. The production of breast milk will be enhanced by regular feedings. Feed your kid until he or she finishes drinking and gets up on their own. Let your infant decide whether or not to accept the other breast after offering it. If your baby is gaining weight and excrete light colored pee at least 6 times each day, he or she is receiving adequate breast milk.
Ay, okay. Pero nakulbaan gid ko bala nurse kay paano abi kung magsala ko or mabudlayan ko?
Help prevent difficulties in breastfeeding. Your baby should be properly positioned and fastened to the breast. Apply some breast milk to your cracked nipples if you have any. Use just the kinds of creams and ointment that your doctor has prescribed. Feed frequently to avoid developing swollen breasts. If you have any issues arise, includes breast pain, blisters, or thrush in your child's mouth, get medical attention.
Ay, amo na siya gali. Now I know. Te, ano naman ang kangaroo care nurse?
Ang kangaroo care, amo ini ang method nga pag-hold sa baby nga naga-involve sa skin-to-skin contact.
Te nga importante na siya.
So if you were to ask what is the importance of kangaroo mother care, this is when implemented after a baby is clinically stable in a hospital. Kangaroo mother care is already known to be successful, reducing mortality among hospitalized newborn with a birth weight less than 2.0 kilograms at 40%. Your baby's heart rate is stabilized as a result of this. Your baby's breathing rhythm will be improved and be made more regular. Also, kangaroo mother care increases oxygen saturation.
Ay, okay. Paano na siya man?
How to practice kangaroo care. The baby is held upright and thrown against the skin of the mother between the breasts, who is the newborn's head on its side. The head and neck and trunk are extended to avoid obstruction of the airway. A cloth wrapped around and under the baby's bottom to create flexion.
Then nurse, ano sinang resulta kung hindi ko napag-ubrahon? Ayabaw na kulbaan gid ko.
Sa imo baby ma'am, if preterm newborn, low birth weight, and full-term newborn.
Okay. Te, ano naman sining benepisyo sa bata ko?
Benefits of kangaroo care newborn: enhanced bonding, breast meal is readily available and accessible, reduce physiologic and behavioral pain response, improve cognitive development and earlier discharge, less so-called an infection, severe illness, and low respiratory tract disease, increased weight gain, restful sleep.
Paano naman sa akon, nurse? Paano ni makabulig sa akon?
Are some benefits of kangaroo care to the mother. Number 1, it promotes bonding with infant. Number 2, increases the breast milk secretion. Number 3, earlier and longer breastfeeding. Number 4, better prepared in this change and more confident in caring for the infant. And number 5, easier to cope with stress and emotion of having premature infants.
Amo na gali. Te, nurse, ano gid gali na silayak, nurse, no?
Yes, ma'am. Para simo, magka-healthy ka nga bata, need natin nga tagaan sang importansya ang breastfeeding kag kangaroo care kaysa after birth gid na ma'am ang pinaka-crucial na part sa baby. Amo gid nga kinahanglan ta mabalaan kung paano kag ano na sila.
Thank you, gid nurse. Tandaan ko gid para sa ikaayo sa akong bata.
You're welcome, ma'am. Always remember that newborns requires essential newborn care to minimize the risk of illness and maximize growth and development.
Sige, bye nurse.
Bye, ma'am!